The rapidly growing healthcare industry needs professionally qualified people to manage affairs and operations. People who are equipped with managerial competencies and also understand healthcare settings. Being a service sector and because of the nature of services, dependence on diverse people is certain. To manage diverse workforce, professionally qualified managers skilled in people dealing are required. Thus, a functional specialization in human resource management in context of healthcare will be the most sought after degree by the healthcare industry to manage its people-related affairs. Present and future times are of specialization, super specialization. Employers wish to spend least time and money in training the entry-level workforce and expect the young entrants to take responsibility and be accountable for results with least gestation period. All industries have their own unique nuances of trade and trends. Healthcare is no exception. Healthcare in India is delivered through public sector, private sector and setups under public-private partnership models. The health sector encapsulates public health systems like IIHMR, sub-centers, primary health centers, community health centers, district, state and national level government hospitals, health ministry, health programs, NGOs, INGOs, private sector players like hospitals, corporate hospitals, charitable hospitals, allied services like pharmaceuticals, healthcare delivery, healthcare support services, healthcare equipments, healthcare insurance, consultancy, telemedicine, health tourism, etc. Since all of these have people working in the setups, the course MBA Human Resource Management in Health and Hospitals offers avenues in the HR departments and the human resource management roles of these setups. The degree is built around contemporary competencies required by the healthcare industry in the domain of human resource management. The course is intense and rigorous. It is designed after a lot of contemplation, research and deliberations with the key stakeholders. The healthcare is a high growth and development sector of the Indian economy. The medical and health services to the masses across the country of good quality and keeping with technological innovations is yet a dream of successive governments post-independence. Sensitive to these needs, we have large medical setups at nodal centers across India, which are struggling to meet the ever-growing needs of the rising population in urban, semi-urban and the rural sectors. Huge investments by the private players and greater fund allocation by the central state governments has retained the high focus on this sector. Thus, there is a need to manage it well as also deliver uninterrupted health services. Over the years, health sector is also marred by acute industrial relations and administrative issues. A triangular management of high-profile doctors, medical technicians and paramedical staff is not an easy job. And most of the hospitals and large institutes have unresolved issues at all times, severely impacting the services rendered by them. Aware of the protective labor and ineffective civil laws, the workmen and even doctors sometimes time and again resort to unreasonable demands or agitations. Such situations warrant a specialist approach to deal with the issues under the gambit of applicable service conditions, organization culture, performance delivery and the legal rights of the parties involved. Amateur, general and short-term approaches would never provide a sustained peaceful environment. So much required in the sector dealing with the sensitivities of sick people and their family members or caregivers. It can be safeguarded only by systematic, well-defined policies, procedures and practices. A high degree of service orientation supported by a congenial work environment, appreciative of workflows and processes would always lead to success and achievement of the objectives of the establishment. An MBA with functional specialization in HR undergoes more generic orientation in HR competencies, which makes the candidate fit in diverse kind of organizations. One has wider canvas to paint one's career in functional specialization of HR. An MBA Health and Hospital will have skills and competencies to work as a manager in any domain of healthcare organization or hospital like quality operations, marketing, knowledge management, consultancy, human resource management and like. In contrast, MBA HRM in Health and Hospital prepares the candidate to work in HR department of health and hospital setups. Most of the first year foundation courses have the same focus as MBA Health and Hospital. It is the second year courses where the departure is more towards intense and rigorous grooming in HR competencies in the MBA HRM in Health and Hospital course. The degree MBA HRM in Health and Hospital is specific to health and allied fields. This degree will also build equal range of HR competencies as a plain MBA HR and simultaneously ground the candidates to health sector specificities. The candidates pursuing this course will have grounded foundation of health policy, health organization, health services and health management in addition to human resource management specialization. The course will offer custom fit HR managers to healthcare industry. The lineage,